Hi, Kassie.
Hi, how are ya?
Good. How are you?
Good. I'm really good.
Thank you for being here on so late on a Wednesday night.
Yeah, no, thanks. We just got back from running errands. We're gonna put hardwood floors, I think, upstairs in our house, and we were doing that.
Should be fun. Is this like nesting?
I don't know, maybe it might be. No, my son has really bad allergies, and we've had croup like 4 times in the past 6 months. So we're like, that's it. Let's do some carpet or hardwoods.
Yeah, I don't blame you. That would be good. Okay, well, I'll give everybody maybe another minute before we dive in. I'm sorry for the harsh lighting here, but
Okay.
and just to let you guys know, I have Gus with me, and he is on the iPad, so hopefully he will be occupied through this. But the other kids are at baseball, and David's their coach. So we just gotta do what we gotta do, right? So anyway, thank you guys for also being here. Hi, Andrea, Paula, hi, Sarah, hi, Megan, Kathy. There's somebody else here, but I don't know who it is. It just says iPhone.
Sarah and
Uh,
I went to school together.
oh, well, how cool. That's awesome.
Yes.
Okay. So first of all, I will, before we kind of get into the training, I'll introduce you and just kind of give everybody um, a little introduction to who you are, and then if anybody has any specific questions for us regarding this topic, I guess I should mention this topic is floor. Oh, hey, Marcy. So if you guys have specific questions or things that you want to learn about tonight, please feel free to put that in the chat. But I think this is going to be such a good conversation. Honestly, I am really excited about it myself because clearly, if you have seen my reel about peeing my pants every time I sneeze, that was not a joke. That is real. And I definitely need to do something about that. So I'll be interested to learn more about it tonight. But I'm sure that there are many people who are in my same shoes. Gosh, this lighting really is terrible. Sorry. Um, and for the longest time, to be honest, I just really didn't think anything about it. I'm just like, well, I've literally had 4 babies actually. And it's just like part of it. But the more I learn about it and more I understand what I um, deal with on a daily basis is not normal and can be fixed. So yeah, Paula said you're not alone. Yeah.
Not alone.
Not alone. So I'm so glad that you are here to chat with us about this. Okay, so first of all, let me introduce Kassie to you guys. She is one of my favorite people. We actually met through the Faster Way. She is a Faster Way coach, and she was a client of mine to start, and it's just been so nice to get to know you through that process. So grateful for our friendship. But Kassie is 37. She has 2 babies right now, a 5-year-old and a 2.5-year-old. And then another one is due in December. So congratulations. I'm so excited for you. I'm glad you're feeling better too, by the
Yes,
way.
much better. Thank
Good.
you.
She lives in Kansas City, Missouri. Actually, I've never told you this, but my cousin lives in Kansas City,
Oh,
and
really?
this is like so off so off base, but they own Louis Wine Dive. Have you ever heard of that?
Yes.
Yeah.
Wow.
Anyways, random. Well, we can talk about that.
Small world. Yes.
So that's interesting.
Yeah.
Okay. Anyways, Kassie has her doctorate in occupational therapy and an emphasis in pelvic floor rehabilitation. So that's what we're here to discuss today. She works in the hospital, treats newly postpartum moms. She is also in an outpatient clinic and sees a variety of diagnoses ranging from pelvic pain, urine, bowel leakage, pain with intercourse, bloating, constipation, trauma, postpartum, prenatal, oncology, all the things. So what she has kind of said to me is that the faster way just really ties beautifully into what she does on a daily basis with her full-time job as an occupational therapist. And she just says that, this is such a great marriage to marry the two. So you all are very lucky tonight in that you have someone that is not only very well versed in this topic that we're going to be talking about tonight, but also very well versed in the faster way. So she kind of knows how to marry those two things. So anyways, I will let you take the floor.
Okay.
And just teach us all the things. Let me see what I've got down here really quickly. Paula says, I actually have a doctor's appointment next week to talk about bladder surgery. Okay.
Yeah.
Then and are you going to talk about that?
Yeah, I will.
Okay.
I'll for sure talk about it. Yeah.
Okay. And then Andrea says, if you have a list of recommended exercises for patients experiencing these symptoms, I would love to have a copy if that's available.
Mhm.
So we can get to some exercises that we can be doing, and well, you can decide, if you want to share a resource.
For sure.
Okay. I'm going to let you take the floor.
Okay. Thank you guys for having me. I'm so excited. I literally could talk pelvic floor health all day long for hours upon end. It kills my husband. But I just got done from the pelvic floor clinic today and got to see 4 new patients and had 4 other ones. And I really enjoy what I do. So during this, I don't see the chat feature, Lauren. So if someone asks a question, can you just tell me and I'll answer it?
Sure. Yeah. Megan says she wants to know tips for pre-children, which
yes,
is a great question.
My favorite kind of question. So first I wanted to go through the anatomy of the pelvic floor so we know what we're talking about. Hey, Dad. Yeah. Do you have your headphones? No. Okay. Sorry guys. My father lives with us. He's fantastic. So the pelvic floor is 3 layers of muscles that go from the front of your pubic symphysis. So right here, lots of times we can have pain right here when we're pregnant, and it hooks around all the way to our coccyx bone way back here. So our tailbone, and it's 3 layers deep. So the first layer right here is called our sexual function layer. So oftentimes when we have pain with sex, it starts right here. These are these little tiny thin muscles that can get very angry, short. Lee and Haven always talk about full range of motion and how range of motion is so important. Same thing goes with the pelvic floor. So if you have any pain with intercourse, it normally starts here. I call these our little gatekeepers. They're like the bouncer of the bar. They don't want anybody causing any riffraff inside. The second layer is our sphincteric layer. So that's going to close and open sphincters when we want it to. Third layer is that big support layer that holds all the organs up inside. So it's like a giant hammock and holds all those organs up inside. And then all the layers of muscles are used for stabilization in the hips, in the spine, in our pubic symphysis right here. And then they all act as a sump pump for lymphatic drainage and blood. So oftentimes when we have intercourse and we'll orgasm, if our muscles are too tense, we can orgasm, but then we'll have pain for 2 or 3 days afterwards, which makes intercourse not as enjoyable knowing that that's coming. So we want to make sure that all those muscles are coordinated, have good range of motion, and are strong. So there's just a little bit about the anatomy to go in so we know what we're talking about.
I have to stop you and ask a question. Is everybody sitting here doing Kegels right now?
It's funny whenever I'm practicing and I'm showing my ladies like how to diaphragmatic breathe and things like that. one asked me today, she's like, so do you just do Kegels all day long with all your patients? And I was like, yeah, I do. I just like practice with you guys. I want to all be together. So, so with this tissue, it's very important to stay hydrated and have good nutrition. That's how we tie it perfectly together with a faster way. I don't go through one of my patients and do not talk about hydration or nutrition. It is probably the third thing I bring up. If you have poor nutrition or poor coordination patterns or poor strength or poor hydration, poor sleep, we go through all of that. That's why I say it goes perfectly together, hand in hand. So we also want to protect this tissue with other things than water and food. But if we're using a pad, if we're leaking urine, we need to be using organic pads, organic tampons, or period cups, or there's period panties that gross people out, but they're actually a really cool invention. The reason why we need to use organic pads or tampons is cotton is grown in a field. It is sprayed with pesticides, a very, necessary evil. Then it's taken to a factory and dipped in bleach, and then we put it against our vaginal tissue. So if you have any kind of vaginal pain, we start there, making sure that tissue is healthy and have nice, good, clean cotton against it, as clean as we can get, right? Nothing is 100% organic that I found, but you want chlorine-free pads, tampons, or period cups, okay? The other thing is to think about lubrication when you're using it for intercourse. So lubrication, the same thing. They fill it with chemicals, they sell it, and then it gets in our vaginal tissue. Our vaginal tissue is actually very absorbent, so it just sucks everything right up into it. So making sure that we use a lubrication that's like Good Clean Love, Uber Love, Coconut, Slippery Stuff, Silk. Coconut oil is a fantastic lubrication, like the kind you cook with. And it's also a fantastic vaginal moisturizer. Is there a question?
Yeah, tell me why you say don't use that with condoms.
Oh, yes. Because you have the chance of breaking that condom down and causing a pregnancy.
Oh.
Yeah, so if you don't want a baby and you're using condoms as a contraception and coconut oil for lubrication, we don't do that. I never recommend that. So I would say use something else that has not had any research behind it breaking the condoms down. It's not hurting anything. It's just going to cause the integrity of the condom to be jeopardized.
Interesting.
So, yeah. Okay. The brands I like for period or tampons or pads, I love Elle, the brand Elle. My daughter's name's Elle, so I just picked that one and that's what I use. Cora, Lola, 7th Generation, Just is a brand at Walmart. So there's lots of them. They're just not marketed the same way that the other, like Tampax, it's bright pink, or there's sporty ones, or there's bright blue ones. Organic ones normally are just in a white box, but they're right there at your Target, Walmart, Price Chopper, Kroger, wherever you guys shop. I've always been able to find them. So let's talk a little bit about bladder health. So I will always relate back to research and what research indicates. Yeah.
Sorry, I
That's
feel
okay.
like I'm one kid in the class. Okay, we have a question about, before we move into a totally different subject, I wanted to just catch this one. She asked if vitamin E oil is a good.
You're going to say vaginal tissue all night long. Vitamin E oil, I've never read any research on it. I don't see why it would not be a great idea. What I would say is always test it on like labia majora, which is your outside vaginal lips, and see if there's any irritation or anything like that. And then you could slowly put it inside and see if there's any burning or itching or funny discharge or smell or anything like that. Then that's your body's way of saying, hey, I don't like that. So I always tell my ladies, our vagina is like it is a self-cleaning oven. There's no douching. We're not scrubbing it. Our body gives us signals, just like our eating signals or our thirst signals or our tired signals. If we have some kind of odor or funny discharge, that is our body saying something isn't right. So when we're constantly cleaning that away, we're ignoring those signals. So there should be no overpowering odor. Typical sweat odor is normal, especially if you're working out with a faster way. But with when you're washing that away, you're changing the pH balance of that tissue, which causes it more susceptible to tear and bacteria to seep in, which causes the odor. So just be aware of that. Self-cleaning oven, water, Dove soap, or Dove isn't even the best. That's what I use, but a bar soap, any kind of soap that's liquid causes the chemicals put into that is typically not the greatest. So just something to keep in mind. I tell my patients that we treat our vaginas like we treat our face. Soft cleansers with moisturizers. Okay. I got the chat feature up now, Lauren, so I can see it now. Lauren helps me, so I can talk all day about vaginas, but to run a computer is like, Jesus, I cannot get it. Oh man. I'm not a fan of Summer's Eve at all. There's been research that indicates that the integrity of that soap, in particular, that brand, has caused issues with vaginal tissue, with UTIs and bacterial vaginosis. If you've ever had bacterial vaginosis or been around someone with it, it causes the most distinct, horrible odor that I think every woman is terrified of. So I'm not a fan of really any liquid soaps. But if you're not using it internally, I would like not even going in, not say inside your body, but inside your lips, I would say absolutely not. Hope that answers. Sorry to be the party pooper on that one. Okay, so bladder health, 5 to 7, we're supposed to urinate 5 to 7 times in a 24-hour period. And this is, I'm telling you guys what research indicates. That's how I always practice. We all don't fit perfectly into research though. So we have to figure out where we fit and where we're comfortable with our quality of life. So 5 to 7 times in a 24-hour period, we should be able to go 3 to 4 hours without urination. Want to wake up more than one time a night, if at all. I try to get all my ladies not waking up at night. The only time you should be waking up at night is to feed or nurse a baby. And if you don't have that, then there's no reason you should be getting out of bed. So we work on making sure that we have really restful sleep. When you start going to the bathroom more and more and more, or those, I call them just in case pees, like, oh, we're getting ready to go to Target, go to the bathroom just in case, or I'm getting ready to do a workout, better go to the bathroom just in case. That causes your bladder to contract more than it should. When you cause that muscle to contract more than it should, it's not only holding the amount of urine that it should be able to hold, we're making it get rid of it before it ever gets used to holding that much urine. We're also not listening to the signals our bladder is sending to our brain, but we're kind of making it up ourselves. So this is a battle me and my husband have, because he's always like, go to the bathroom, we're going to the park, go to the bathroom, we're going to the store. I'm like, she just went, it's fine. But we all do it as parents for sure. And I think that's when our routines and habits start to change, when we become parents and our kids we don't want to take them to the bathroom when we're at the grocery store. We want it done at home so we don't have the nuisance of it. But that actually builds really bad patterns for your bladder, and it doesn't allow those little ones to really feed into that signal of what is my bladder telling me. So there is something called frequency incontinence, which you're going to the bathroom so much that you're starting to dribble a little urine, maybe right when you get to the bathroom, after you urinate or maybe throughout the day. Then there's urgency incontinence where you're like, oh, if I don't get to the bathroom right now, I'm going to pee my pants. Rushing to the bathroom creates this big central nervous system. Like, am I being chased by a bear or do I just need to go to the bathroom? Your body has no idea which one. So it's going to react like you're being chased by a bear in that protection mode. So no matter how fast you get to that bathroom, you're most likely going to leak urine. So what I tell all my patients to do is to start when you feel that urgency kick up, do some big diaphragmatic breathing, calm everything down, and walk to the bathroom on your time instead of putting that fight or flight mode into your system. Okay. So I tell people that the bladder is like a bossy 2-year-old, that if you let it boss you around, it's going to. So you have to put structure and you be the boss of it. Okay. So we don't want to void too frequently. We never want to rush to the bathroom. Now, the biggest one I see is obviously stress incontinence, where people are like, I don't want to work out. I don't want to go for walks. I can't get out of bed without peeing my pants, or leaking a little bit of urine. And I tell my women and men, I treat men too, any urination that comes out, any pee that comes out when we don't want it to is called incontinence. So no matter how little or how big, it's incontinence, because we should have complete control of that. So it's an important topic for me because 50% of like nursing home admissions are because a patient is incontinent. Now you just wonder, like, this woman had 7 kids. Nobody ever told her that this wasn't normal. She just thought it was part of having babies. I was incontinent before I had kids. I had a prolapse before I had kids. I had pain with intercourse, and nobody ever said anything to me. And I went to doctor after doctor after doctor. So it's really important to advocate for yourself for sure. Yes, Paula, I don't want you to get up 3 times a night, Lord, unless you're rocking that sweet baby. That's the only time it's okay to get up in the middle of the night. But yeah, so a lot of mine is about, and that's part of being an OT, is we look at someone's routines and habits. And a lot of times it is purely a habit we have formed. And now we've gotten into our head where there's no way we can get to the bathroom in time, or there's no way that we can go to Target without having to urinate. And then once you start messing with your sleep cycle, we all know how difficult that can be to get back on board with that. So your body probably just automatically wakes up now and you're like, well, I'm awake. I might as well go to the bathroom. Because if you do wake up, your bladder is more full. It's going the longest part of the day without urinating. So getting the daytime under control first, and then work on that nighttime sleep schedule is how you start to really focus on not getting up as much. You can try, Paula, when you wake up in the middle of the night, see if, okay, I can do a couple diaphragmatic breaths, big belly breaths, relax everything, and try to go back to sleep. And even that deference for 30 seconds is telling your bladder, we're okay, I'm in charge. And then if you feel like, okay, no, I really need to go, then you get up and go. And each night you do that, that will get less and less. The other thing I want to talk about is straining to void. So lots of times work, being a mom, being a student, being just human, we are always in a hurry in this country. And so we get on the toilet and we're like, we got to push to get it out as fast as we can to get back to what we're doing, because the world is going to completely fall apart if I'm not back in 1 minute. Well, the average length of a bathroom visit is like 1 minute, 30 seconds. So the world won't fall apart. And you pushing to get urine out is actually pushing your organs like uterus, bladder, or rectum south, which we don't want to do. And then you're more likely to spend more time in the bathroom because the muscles are contracting instead of relaxing. So no straining to void urine and no straining to void bowel. So the only time you should be voiding or straining is when you're delivering a human, literally. So if you're having to strain with bowel, Lauren made the most beautiful post. It gave me chills. And I'm probably your only client who's like, oh my God, I love your poop post. But I was like, she nailed it. I love this. So good. So
definitely learned a lot about poop in the last few years.
I know you have, because I'm starting to treat pediatrics a little bit now too. And I know Lauren and I have talked about her little guy. Constipation and pooping for little people are just, it is a tough area. And you can't reason with a 3-year-old about why they have to poop. And so, and it's devastating to parents. So I have a girl right now, she's 21, but she's been constipated since 18 months old. And the impact that has done to her entire life has been limiting functionally big time. So I always tell people, like, this is a serious, very serious quest to get on and do as much research as you can and find a good therapist near you to get that started. How is Gus's pooping? Is it better?
Yes, he's
good.
Like completely over it.
Oh, good. Yeah. It's like that little hump they got to get through, and hopefully they get through it. Some of them don't, but that's wonderful.
It was a very stressful thing, but
my heart hurt for you. Yeah, that's tough. Because parents feel completely they just don't even know, and their babies are miserable, and it would all go away if they would just poop, but the kids can't do it. So much psychology is going on in there, and then physical. So not a fun time. So I'm glad he's better. So the bladder sends us 3 signals. So first signal is saying, hey, I'm filling up. Just wanted to let you know. Second signal is, hey, let's find a bathroom. Third signal is like, girl, you waited too long and now I'm pissed. So I want you guys to start feeding into those signals, realizing and being more aware of how long has it been since I went to the bathroom. So I can't tell you how many of my patients tell me on a daily basis, oh, but I drink a lot of water. So do I, sister. What you have to do is really train your body. We want to be drinking water throughout the day rather than chugging it down in one full setting. That makes us feel bloated. It overloads the bladder, which is traumatic for the bladder, and we will just push it out. So make sure that you're drinking enough water through the day. Now, someone who doesn't drink water, I always hate New Year's, like around New Year's time when people are like, my new goal is to drink 100 ounces of water. And I'm like, oh God, don't do that. I tell my patients to go 10 ounces a week increase. So I had a patient today, she drinks coffee and beer. I'm not kidding. That's the only thing she consumes in a day. She's all party, I guess. I don't know. So I don't want her to go from 0 to 64 ounces. I want her to go 10 ounces for a week, then add 5 ounces, do that for a week and see how it goes. So we can train the bladder to withstand that much fluid, and then add to it and not over traumatize it. Okay. So
that's so helpful. Yeah.
Yes. A bunch of my girlfriends were doing 75 hard, which I'm, great. Do you, girl, but don't drink a gallon of water when you drink 30 ounces in a day. That you're just you're going to leak urine. And once you distend that bladder, so once you fill that bladder over and over and over too much, it will stay that size, and that causes a problem too. So we want to respect that organ system and its signals. So stress incontinence is what we all, a lot of people have. I do not have it anymore. I used to run on a treadmill and just pour urine. And I remember the doctor being like, you're just working out really hard. Good job. And I'm like, yeah, I'm so good at working out. That was not the case. I was peeing myself, literally, like I needed a diaper. And so, stress incontinence is anytime you cough, sneeze, laugh, exercise, unload groceries, unloading laundry, picking up a baby, squatting down and picking up something off the floor. If you look at all your functional activities through the day, here comes my OT side, all your functional activities through the day, and you replace laundry with dumbbells and you're doing, transferring, that's a huge exercise. Or if you're putting groceries away or dishes away and you replace that with a dumbbell, then now we look at it as exercise. So all of that, all we do during the day is a lot of exercise. So making sure we have proper body mechanics when we do that, just like Lee and Haven and Amanda talk about in the workouts, is making sure we're exhaling on the hardest part of the exercise and breathing through everything. We have to stay oxygenated during our workouts, whether we're doing laundry or we're doing our faster way workouts. People think that if they leak urine, they must have really weak muscles and really loose muscles. That's not the case. A lot of times, in fact, the muscles are more tight and they don't move as well. So when we're working on our bicep, this is full extension, this bicep's relaxed. And then we pull up with a dumbbell, that's that tension on it. So lots of people are trying to do Kegels from here. Well, we would never work a bicep out from here. So we have to work on relaxation of all the muscles of the pelvic floor. So people say, okay, what exercises can I do? In my practice, I go through a whole slew interview, and then I do an internal assessment and I look at each muscle layer with my finger, and I go through and I check, is there any tension? How does the pelvic floor move? Can you contract? Can you relax? And most of the time people can't relax. So what I would give every single human who walked through my door or online, or what I'm comfortable with doing, because I don't know what your pelvic floor feels like, is work on that diaphragmatic breathing and making sure you can relax completely. Because if I gave you an exercise prescription per se, do 15 Kegels twice a day, well, I could be working out a really tight pelvis, causing you more pain, less range of motion, poor coordination. So we have to work on the relaxation first. So YouTube diaphragmatic breathing and see if, and work on that for a little bit. I would say like 2 weeks of diaphragmatic breathing.
I was going to say, how do you relax your pelvic floor?
Through diaphragmatic. Yeah. So I can't even do it right now because I have such a big belly, but that's huge. Okay. So when you go, I don't know if you guys can even see it, but it expands, and then we exhale. So the pelvic floor works like a piston, right? So you have your diaphragm, your pelvic floor down here. And so when you take that big breath, everything goes down. And when you exhale, everything contracts without you necessarily doing a Kegel per se. So working on that big belly breath without chest moving, but just belly moving, and looking for the sensation of relaxing your pelvic floor. 9 times out of 10, after I give that to somebody for a week, they come back the next week and they say, I have no idea what I'm doing. And you don't, because you've never been taught. So I don't expect you to know how to run a marathon in a week. You just have to work on that every single day, just like you work on any other exercise. And the more practice you do, the easier it gets. And then one day you're going to be laying there and you're going to be like, oh my God, I can feel it getting relaxed. I feel it getting longer. I feel a different sensation. And that's what I'm looking for. But that's what I have every single person, no matter what their symptoms are, to start with diaphragmatic breathing. Okay. Diaphragmatic breathing. Yep. Okay. So knowing that coughing, sneezing, laughing, exercising, and leaking any urine is not normal. not a normal function. We don't have to be punished for the rest of our life for bringing children into this world. And like I said, I don't leak any urine now. I leaked a ton when I was 22. So thinking about what's normal function of that muscle group is really important. Here's what I have with bladder surgery. And you guys have to remember that I see a different side than people recovering very well and everything going very well. I see the side that doesn't go very well, but I read a lot of research. And so bladder surgery, what they do is they go in and they kind of sling that bladder up, either with mesh or they tie it up back to where it's not prolapsing, meaning back to its original anatomical position. After we carry babies, if we have abdominal surgeries, I mean, I've had 5 abdominal surgeries, so things shifted way before I had babies. If you have a vaginal birth, a C-section birth, if you have poor body mechanics, all of that plays into where anatomically your organs sit, and they change with pregnancy. So when we go in and we sling up the bladder, we're not because we're leaking urine or we're having symptoms of prolapse. Symptoms of prolapse could be back pain, discharge, feeling heaviness or full when we're seated. Normally at nighttime, it's the worst because all those muscles are fatigued. So when we're doing that, we want those symptoms gone, pain with intercourse. So they go sling it up. Well, they're never addressing the muscle function. So if you're going to have a consult with a doctor about a bladder surgery, I would say, can I do prehab? Can I do some pelvic floor rehab before I do surgery so my muscle function is that much better? And then afterwards, 100% you do pelvic floor rehab. If you think about your rotator cuff, and if you get a little nick in there, you go to rehab for 12 weeks. Sometimes 6 weeks before and then 12 weeks afterwards, but you have a bladder, your organ like taped back up and they're like, see ya. So make sure to do your due diligence in advocating for, can I do some therapy before? Not can I want to do therapy before and I want to do therapy after. Who do you recommend? And then going and meeting with that therapist and seeing how that goes. I hope that answers anything about bladder surgery. I don't want to scare anybody, but the reality is,
my apologies.
Oh.
I couldn't.
The reality of it is we're not given all the information. And so knowing that we can do some muscle function work before we go in and have a pretty significant surgery is absolutely important to do. So let's talk a little bit about bowel health. So like with the bladder, you get 3 signals. With bowel, you get 1. You either listen to that signal and you relieve bowel or void bowel, you don't listen to it and poop your pants, or you become constipated. Most people go constipation. So constipation is not a normal function of our bowel. Being diagnosed with IBS, overactive bladder, I'm trying to think of some of my favorite ones that the doctors send me. Those don't really tell me anything as a therapist other than your belly is irritated and we have not figured out why, and your bowel is not functioning appropriately. And that's why we have to look at the food you're eating, do allergy testing, do sensitivity testing. But they don't, they don't do that. Not the doctors around. I have 4 or 5 orders next week that are abdominal bloating. And last week I had 3. And when I talked to these women, my beer and a coffee drinker, I said, well, tell me a little about your diet. And she goes, you're the first one who's asked me that. Now, this woman has lost 60 pounds, has abdominal pain. They took her gallbladder out and they never asked her one question about her diet. A gastro doctor, so a stomach doctor. So when I asked her what her fluid, and it's really, really important to say, what fluid do you drink? Because fluid affects us differently. Water is going to look different than coffee or beer to our system. She eats fried catfish and macaroni and cheese every night. It was just like, no wonder why your tummy hurts, sweetheart. So it's really important to do your due diligence on that too. So constipation is not normal. Making sure you're in a good position and posture on the toilet is really important. So a squatty potty, getting your knees above your hip joints, putting your feet up on a stool. I love squatty potty. They're sold on Amazon, Bed Bath & Beyond, wherever. Putting your knees above your hips. So down like that, sitting in that position, reduces this muscle around the anus, will squeeze shut. When our knees go up above our hip joints, that muscle relaxes. So if you're in a bad position on the toilet, it can cause you to strain and bear down. And remember, we don't push for anything unless it's a baby. So getting in a good position on the toilet and doing lots of diaphragmatic breathing to relax that pelvic floor, blowing out the candles so you're contracting your inner core, but not straining, is also beautiful. Okay. You can also, so when you blow out the candles, since our anatomy changes as we age, changing different positions on the toilet is absolutely necessary too. So I call it the rock and roll for my kiddos. I call it the swan dive. So they go down and touch the floor, and it's kind of pinching their tummy, helping with that contraction without bearing down. But for my adults, I call it the rock and roll. So any other questions? Let me see. Okay.
I think we're good. I'm watching.
Okay. So we talked about coordination patterns, just like any other muscle group. So if you guys do Lee's boxing, I always feel like a complete idiot. And I'm like, I don't want to do it because I feel like an idiot. The coordination is so significant, but the more you do it, the better practice you'll get. And it's the same thing with your muscle group, your pelvic floor muscle group. The more practice you do that diaphragmatic breathing, you're going to have good coordination patterns. You're going to have good mechanics with your breathing while you're lifting weights. Haven always gives, I'm very picky about the cues given, especially with postpartum mamas, and she gives such beautiful pelvic floor cues along with breathing cues. And it's really important to listen to those cues. I'll even catch myself holding my breath. So important to remember. If you're doing an exercise where you're leaking urine, if you're doing like the ton of frog jumps we do, or the moguls, and you're leaking urine, modify that exercise. Going through it continuously is only going to make that coordination pattern with your pelvic floor worse. So it's like if you're trying to isolate your pelvic floor and you're using your lower back, we're not doing anything for the pelvic floor, but we're overworking our back. Same thing when we're lifting weights that are too heavy. If we're not isolating the bicep and we're using our lower back instead, that doesn't make a ton of sense. So modify those exercises. So the muscle group working, like with box jumps or something like that, do step ups and alternate legs, or do whatever modification they have. If even the modification they have is not good enough, you can always send me a message. I can modify any exercise, or walk in place. I mean, you're moving your body, and that's the important part. I don't want you, and work on your breathing while you're doing that. Just don't walk in place to go through the motions, but work on your breathing. Always exhaling at the hardest part of the exercise. Let's see. Okay. Pain with intercourse real fast. Not normal. It's not normal after babies. It's not normal before babies. So having a doctor tell you to drink a glass of wine, or just relax, or use this muscle relaxer, that is your body. Pain is that signal that is telling us something is not right. So I want you to listen to it. So if you're having pain with intercourse, something's not right, and we need to work on that coordination and relax those muscles. Hydrate the muscles, moisturize the muscles, use good self-care products, stretch those muscles, make sure back is nice and loose, and then talk to somebody about getting into a pelvic floor therapist if the pain doesn't go away. But pain after babies is not normal, nor anytime. Unwanted pain with intercourse is not normal. The things I hear in my practice room, I have changed my vocabulary to unwanted pain is not normal, because some people like pain and that's just their cup of tea. There are instruments that can help with stretching the pelvic floor, like dilators or wands. If you were to go into that, I would want you to be supervised by a pelvic floor therapist. And if there's not one in your area, there's oftentimes not, you can always message me and we can go through what you think, what you need to do that safely. UTIs. UTIs are not normal. They are an infection in your urinary tract system. If you're having multiple UTIs a year, we need to figure out if we're voiding completely every time, if we're dribbling after urination, if we're going too frequently, if we're using another self-care product that's not working well, or causing irritation to that skin. Not normal. So don't just keep taking antibiotics and saying, I just get UTIs. It's like, I hear this all the time. I've always had UTIs, or I've always had constipation. Well, that doesn't make it okay. So, for the person who wants to know what to do before babies. So being pregnant is an athletic event. So being in the best shape you can be, it's not always, I was in the worst shape of my life with my first 2 pregnancies, but making sure you're strong, you're eating well, you're sleeping really well is important. Making sure that vaginal tissue is protected, and then being able to really work on that diaphragmatic breathing and those coordination patterns with your pelvic floor will save your back and your like pubic symphysis area so much. So making sure that you're just breathing healthy, drinking enough water, getting good sleep is where we start. I have C-sections, and I start doing my pelvic floor exercises as soon as my epidural wears off or my spinal wears off. I start working on my breathing patterns because I want that tissue to move nicely. If you've had any C-sections, you need to make sure that those scars move really well. Scar tissue is like a sticky spider web that clings to muscle tissue and can make it not move as well. So I don't care if you're 6 weeks postpartum or 60 years postpartum, I always work on your scars. So moving them up and down, moving across, moving little circles on them to help make sure that that is moving well. Okay, that is all. That is all that I have tonight. Anybody have any questions?
This was so helpful. I love hearing you breathe because you're so pregnant.
So pregnant. And I'm not even so pregnant. I'm just like, cannot breathe already. My babies have always sat so high.
Mine too.
Oh man, it's like a shelf for my boobs. Jessica, I can, if you follow me on Instagram, you and I can have a conversation about that. Okay. Scar massage, Ashley, scar massage, you can do as much as you'd like. I love using castor oil. It penetrates a little bit better, but coconut oil is very soothing and has lots of nutrients too.
So as you were talking about this and how you had incontinence so early, I just remember now, like when I cheered in college and we would tumble, I'd have to go to the bathroom. Like I would pee myself every single pass that I did. And I was like so embarrassed because of it, but never talked about it. Didn't know that it was not a normal thing, just all the things that you're saying. And I just hate that I've basically gone, years and years of my life without really understanding that there's a way to fix it, or that there's a problem,
Yeah.
Even.
I have, for the oncology patients, I have 2 oncology patients right now who have anal cancer. I have one that has vaginal cancer, and I have one that has uterine cancer. And they have all battled the biggest battle of their life, right? And all that tissue with radiation and chemotherapy has really caused a lot of damage. And so they get almost upset with their oncologist. Why didn't they tell me about this? Well, that's not their specialty. Their specialty is to keep you alive. And that's where their focus is going to be. And that is more important than how muscle tissue will function. But that doesn't mean it's not important once you get through that really tough time. And so making sure that you have that discussion with your oncologist or your physician or your cardiologist. I spoke to a group of like 200 doctors 2 years ago, and it was a room full of cardiologists. And I couldn't believe when I got done, there was probably like 15 or 18 in line asking me questions about specific medications or what they can do after heart surgery. And it was like they had no idea that this was an area that could be treated. So it's, I'm hard on doctors, but I also understand that's not their specialty. Just like my specialty isn't cardiology or oncology, it's muscle function. So,
Yeah. I need to look for a good pelvic floor specialist in our area. Andrea just asked if I found one in Kentucky, and I have not looked yet, but I need to do that.
Yeah.
So tell me, what's the difference in an OT and a PT?
I love this question.
You knew it.
I get it a lot because this field is more dominated by physical therapists. The difference between OTs and PTs, we carry the same degree, just in different focus in different areas. So where I'm very functional and psychosocial, and those areas I'm more, I hate saying this, but I'm more educated up top than I am bottom during school. But once you go into learning, once you go to your pelvic floor courses, neither one of us really have PT or OT don't have education during our like master's or doctorate degree. You have to go outside of that. And we sit right next to each other in the same classrooms, learning how to treat it. So really, it just depends on if there's a PT or OT in your area. Either one will be fine. But I would say the most important thing, because obviously my connection with my patients is number one, hands down, have to be comfortable with my therapist. If you are not comfortable with your therapist and sharing intimate details about pooping, peeing, intercourse, and I totally respect someone, I don't need to know details, but if you're having pain with intercourse, I want you to be comfortable and say, hey, Cass, I'm having pain with intercourse, instead of being so uncomfortable with someone you can't share that. That's important for me to know, to clinically reason through things. So I look a lot at routines and habits and how this affects someone's psychology too, where that's really, really important. I worked with a group of women who were all PTs and I was the only OT. And when we treated, you would not be able to tell who was PT and OT, what degree they had. So that's really, there's not a huge, we don't treat anything differently. It's just our backgrounds might be a tiny bit different.
Yeah, that makes sense. Okay, I have one more question. Does anybody else have any questions? Clearly, this is like the Lauren show because I've asked so many questions. Sorry, but if you guys have questions, please feel free to interject. But when you were talking about the bladder reconstruction or whatever you call that surgery, my mom had that a couple years ago, and I just was texting her just now because I was like, I wonder if she did any rehab. And she just told me that they said she was too far, like it was too late. I knew you were going to say that.
This is why I'm so hard on doctors, because they don't know. How would you know? You don't treat that.
Yeah.
So that would be, so there's different grades of prolapses. If that was her main, and I'm guessing she had bladder movement, and they grade it, grade 1, 2, 3, or 4. Grade 1 and 2, we can get rid of a lot of the symptoms. Maybe bladder can be pulled back up by muscles. Once you get to grade 3 or 4, 4 is outside of the body, which people function like that and then go about their day like that. That is when I say, okay, surgery is an absolute necessity. That doesn't mean that you would still not do anything for the muscles that hold that bladder up, because if you never focus on body mechanics or breathing or muscle function, where's the bladder eventually going to go? Because every surgery basically fails eventually. Time and gravity pull everything south. So it's never too late. My oldest patient was 87. She had a prolapsed uterus, stage 4, grade 4. It would like lay on my table. She was not a surgery candidate because she was older and had so many heart issues, and her goal was to have intercourse. And how was she going to do that? And I said, let's do it. Let's try to figure it out. And she did. She had pain-free intercourse. She went from wearing like 8 pads to 4 pads a day, which to me was huge considering where her anatomy was. So I might not, it might not fix where the uterus or the bladder is, but it's going to fix the symptoms, or it's going to at least help the symptoms of what that brings, what a prolapse brings or incontinence brings.
Yeah. And you said, the other thing that maybe think of her is she's had issues with UTIs, and I'm just wondering if the rehab is something that she could have done to prevent that, or she needs to do at this point. Definitely.
Yeah. I think all women of any stage of life, it should be like a course in high school, how to function these muscles, considering how vital they are to our organ system. So making sure, I don't think it's ever too late. Like I said, I have seen patients as young as 6 all the way up to 87. And they've all done really, my children are my hardest, and that's because they're just so stubborn and don't understand. But yeah, I don't think it's ever too late for sure. If you get a good therapist, if you get a good, they're in every field, right? There's going to be people who are just need to retire or need to switch professions. So if you ever feel like that, then you need to find a different therapist, and that's okay. Yeah, the access is hard, Andrea. It really is. Come see me, come to Kansas City. Yeah, so I'm trying, women's health is something that I advocate for. I talk about it on Instagram. I'm a faster weight coach and absolutely love that. And I love tying them together. But if I can just help one woman and know that they don't have to go through this, because it doesn't get better. It's like expecting to lose weight, but never changing anything. It just won't. You won't. So you have to put in the effort and time into making sure that your muscles are functioning appropriately.
Right. Okay. So you tell me where we can find you. You said Instagram. Maybe give us your handle if you want to put it in the chat feature, and just, any communication you would be open to having with here.
Let me see. I have women all the time. This is my handle. I have Sarah, just in case. Yes. You're an OT, Sarah. You know better than that. So you can message me on Instagram anytime. I get questions, probably 5 to 10 questions a day, especially after I post a reel or something. And I do my very best to answer those questions as generically as I can, just because I don't know how your muscle tissue is. But like with Sarah's question, I get this a lot. I just in case pee, or I wake up 3 times a night and pee, or when I sit down to urinate, I only urinate for 6 seconds. What does this mean? So with the just in case potting, One of the things I would say is when you feel that urge to go to the bathroom, I want you to recognize when the last time you went to the bathroom was. And can you do some diaphragmatic breathing, distract yourself a little bit, and then go to the bathroom on your terms, like in 10 minutes, just like with urgency. The just in case peeing turns into urgency, frequency, and then stress incontinence. So making sure that you are being diligent about your routines and habits. So there are times, don't get me wrong, where I'm like, I'm going to Target. I can't breathe. I probably need to go to the bathroom, but I just went 30 minutes ago and I will not go because I am the boss of this bladder. And then when I get to Target and I need to go, it's not the biggest inconvenience of the world. So just being mindful of, is it a big deal if I have to go out in public, or if you're on a 4-hour drive or an 8-hour drive, is it a big deal if I have to stop and use the restroom? It's a bigger deal now because we're in a pandemic and I don't want to go into a gas station and sit on that toilet, but I will do that for the protection of my bladder health. Oh no, yes, it's very bad. No hovering over any toilet, any porta potty. I have a serious phobia of
Baseball park. Oh Lord.
I know. I grew up outside, like we just hovered and squat, which squatting is great. So if you want to squat in the grass, Lauren, get to it at the baseball park, just squat your butt in the grass. Hovering is bad. And let me tell you why. You're in a squat position, right? So you're in a squat doing an exercise, trying to relax your pelvic floor. So your quads are firing, your hamstrings are firing, your adductors, the inner muscles of your legs are firing and contracting, which are all connected to your pelvic floor. So you're trying to urinate through contracted muscles. It disrupts the coordination patterns. Okay, so no hovering, put down whatever you need to put down. They do have this. I had one lady who, oh my God, she would not go out in public to save her life. So I bought her on Amazon toilet seat covers, and that's what we did.
Literally going to suggest that. I think I'm going to go buy some
toilet seat covers. I have a serious phobia of porta potties. So like if I go to a sporting event, it's just like, I cannot pee on someone else's poop. Like I cannot do it. It kills me. So I won't drink or do anything at a sporting event because I'm like, there's no way I'm going tailgating and having to pee on someone's poop. I can't do it. Won't do it.
All right. Well, I won't keep you any longer. Thank you so much for your patience and answering all of my questions. And this was really helpful. And I've learned so much tonight, like truly. And I enjoy that. You know how I'm pretty nerdy, so I enjoy continuing education.
Yes.
But hopefully, I think everybody else probably can say the same, that this was super helpful. And yeah, so thank you so much. And everyone needs to be following Kassie on Instagram, and you can continue to learn from her there. Yeah. Can you?
Sorry about my breathing.
No,
it's not going to get any better.
No, it's okay. Paula wants you to come to Columbus. So
okay.
If, maybe this is your new thing. You are going to start a truck.
Yes.
OT truck, and you're just going to travel the United States and come to Kentucky and fix my problems.
Yes. I want to move south. So I'll just tell my husband, we're just going to go on a road trip and we're just heading south all over the place. Yes.
Just work with people along the way.
Yeah. Yes. Yeah. Okay, guys, thanks for having me. If you have any questions, I'm an open book. I am here to share whatever you need. Okay.
Yes. Thank you so much.
Thanks for having me, Lauren.
All right. Bye-bye.
Bye.